Hi, this is Lindsay Sullivan back at Bone and Joint Institute of Tennessee with our monthly Facebook Live series with our physicians. So today we're going to be talking about pockets. So about a front pocket versus a back pocket and how we can help differentiate between hip pain and potential back pain. But first I want to introduce Dr. Colin Looney, one of our sports medicine and total joint specialists. Dr. Looney, welcome today. Thank you for taking some time out of your day to talk with us and introduce yourself.
Well, thanks for having me.
Absolutely.
It's a great topic. I've been with this group of physicians. Honored to be with them for over 16 years, in Franklin with my family and doing sports medicine and hip replacement and joint replacement during that time as well. I see a mixed group of folks, athletes as well as hip and knee arthritis as well.
Awesome. So many people experience either low back pain or hip pain throughout their lives, and they can often be related. So when you see a patient, how do you help differentiate between the two? Yeah,
so often it's asking where the pain is coming from, and if I'm not if I'm not with the patient, a lot of times I can help them get to the bottom of it just by asking them to describe. Okay, is it in the front pocket area, the side pocket area, the back pocket area? Because very often you can differentiate the type of quote unquote hip pain from the area which is emanating. I mean, the most common misconception and the thing we see the most of is because we're all human, we think, well, if it's back here in this sort of this side of my buttock area, well, certainly it's got to be my hip. And people don't suspect their back because typically that pain doesn't hurt in the back. So if there's not central back pain and it hurts just in the buttock, one would assume it was a hip. But 99 times out of 100, that is actually coming out of your lower lumbar area.
Okay.
Yeah. And so that's a real quick question is just, all right, what part of the hip is it? The front pocket, the side pocket, or the back pocket? And what people will often describe their actual hip pain is sort of a C sign, and as hip surgeons we call it the C sign. You kind of grab right there and say, it's right in here, doc, it's right there. And that's kind of classic frontal hip pain coming out of the hip joint. That C sign, and it's more of a front pocket type pain that we see with actual hip pain.
Okay.
And that's a quick way for our patients to sort of differentiate, am I having back pain or am I having hip pain?
Having actual hip pain. So
right.
So to really just visualize literally a pair of pants. Right. Is that what that's kind of how we're describing it? Talk to me a little bit about the side pocket though. You mentioned that.
Yeah. So that is the actual most common type of discomfort. And that is, that is what we often refer to in sort of generic terms as bursitis.
Bursitis, okay.
And the most common culprit is actually the low back. Okay. So most people with low back pain have some element of bursitis. Okay. And that will be on the side, and so kind of right in there. And then it is also a condition of being human. Okay. Most women, in their 50s or 60s, will have one bout of hip pain on the outside of their hip. And we call that trochanteric bursitis, or hip bursitis is the generic term. And it responds very well to physical therapy and it is not a surgical problem. Okay. It improves. But that would be the most common condition to cause pain in and around the hip area, and that's side pocket pain. Side pocket pain. That sort of trochanteric or hip bursitis.
Hip bursitis.
Yeah.
So if a patient comes into your clinic, what type of imaging would they do to? I know you've talked to the patient, but just to confirm a diagnosis.
Yeah. So very often there's a lot of overlap, and so what we'll often do is I would say at least 80% of the time we'll actually image someone's back and their hip. Okay. So we'll get x-rays of the back and the hip because there is a lot of interplay. And particularly when patients are having symptoms from both. From both, okay. So it is not an unusual day in my clinic to get x-rays of both. Of both. And your specialty would be more of that front pocket. I'm a hip surgeon. Yeah, so correct, yes. Talk to me about some of the treatments you would suggest with someone with true front pocket pain. Yeah. So there's a lot of different things that can cause true hip pain in the hip joint. In the older, in the older subset, that would be more like arthritis.
Arthritis, okay.
And mild arthritis we very often treat non-surgically.
Okay.
With anti-inflammatories, physical therapy,
Okay.
activity modifications, and just but a lot of times arthritis is fairly progressed.
Okay.
And that would be a condition where we discuss a hip replacement.
Hip replacement. Okay.
Where patients' lives are very impaired from their hip. And that can improve people's lives considerably. In the younger in a younger subset, that there are soft tissue injuries around the hip that can occur.
Okay.
Often ones that I see most often would be a hip flexor injury that is a non-surgical problem that improves with physical therapy. There's a condition called a labral tear and impingement where we have patients that have a soft tissue injury to the O-ring around the hip socket, if you will. And that can cause pain, and often we'll treat that with therapy, but if it doesn't respond to therapy, we will sometimes operate on that.
Okay. Okay. And so talk to me a little bit about when a patient comes in, whether it be front pocket or back pocket, talk about how the team at Bone and Joint works together for the patient experience.
Yeah, as I mentioned, I've worked with this great group of physicians for a while, and the real power we have is that we have the ability to take care of a lot of different types of musculoskeletal injury. In the floor above me, for that back pocket pain, we actually have 8 providers who provide great care for the spine, and so we have a lot of availability to be seen for low back, and I have multiple other partners who also see hip pathology like I do. So that in itself, we have a great core group of physician assistants and MDs. But on top of that, just down the hall, we also have a great group of therapists who will treat that. Right. So we're sort of in a comprehensive approach to that.
Okay.
And we try to work in tandem with our therapists to make sure that patients are getting the best care, and that sort of comprehensive approach. And again, we see so much overlap. A lot of times I will treat someone whose primary problem is their hip, and they get better from their hip, and they start to have lumbar pain, and there's an easy transition to our team upstairs that treats that sort of buttock pain.
That's great. And so everything can be done here in the office or with one of our even satellite physical therapy locations as well. So that's great.
Yeah.
Well, Dr. Looney, thank you so much for your time today, helping us to differentiate between that front pocket, that back pocket, and even that side pocket pain.
Sure.
So for any questions or to schedule an appointment with Dr. Looney, you can check out our website at boneandjointtn.org or give us a call at 615-791-2630. Dr. Looney, thank you again for your time, and we appreciate you tuning in.
Thank you.